Hi, my name is Jillian Washko and I'm the head of the CDC. Today we are going to talk about the outbreak of the coronavirus. The coronavirus disease 2019 is a respiratory illness that can rapidly spread from person to person. It originated from a new coronavirus first detected in China. The World Health Organization officially named the disease COVID-19. Co stands for corona, V stands for virus, D meaning disease, and 19 standing for 2019. The first cases were seen in 2019. The name was chosen to avoid references to a specific location, like Wuhan, China. The virus that causes COVID-19 is SARS-CoV-2. Public health officials suspect that a new form of SARS originated at a live animal market in Wuhan, China, where dozens of workers were infected at once. This led to the highly contagious coronavirus disease. It is currently spread to 82 locations around the world, including major locations like Mexico, the United States, Europe, and Asia. Areas with high population density are most at risk for future outbreak. This includes the countries and cities in Europe, Japan, South Korea, and Iran, for example. As of right now, there is not a treatment. It is recommended that you avoid exposure to the virus by not touching your eyes, nose, or mouth. People should avoid being near people that are sick. You should also wash your hands multiple times a day and avoid travel to places affected by this virus.
Hi, I am Emily Cook and I'm the Chief Medical Officer. The populations of the public that are at the highest risk are the elderly, very young children, and people with other illnesses. People over the age of 65 have worse overall health and weaker immune system. Similarly, people with pre-existing illnesses are more susceptible to COVID-19. Men have a higher chance of chronic illnesses such as cardiovascular disease, so it is also believed that men have a higher risk for the virus. The virus spreads from person to person or from contact with an infected surface. If you are within 6 feet of someone infected, you are at risk of catching the virus. It gets spread through coughing and sneezing. If the respiratory droplets land either near your mouth or nose, then you're at very high risk. Although getting the virus through surface contact is more unlikely, it is still possible. If the infected person touches their nose, mouth, or possibly their eyes and then touches the surface, it could still spread their germs. A lot of people are wondering how coronavirus compares to past viruses. Compared to the coronavirus, Ebola was less contagious and transmitted mainly by body fluids. The coronavirus can be transmitted in coughed and sneezed respiratory droplets that linger on surfaces. And yet Ebola infected more than 28,000 people and caused more than 11,000 deaths. Ebola is more lethal, and shortages of staff and supplies, poverty, delays by leaders, and distrust of government exacerbated the outbreak.
Hi, I'm Hope Wisser and I'm the Director of Federal Emergency Management Agency. The scientific and medical community are currently doing work to help this world health issue. They're trying to create a vaccine and make people more aware. Our plans to contain the outbreak are to have everyone coming into the United States tested for the virus, so if they test positive, they can be treated and placed in quarantine. Schools should be shut down if anyone in an area or school district is found positive for the virus. The public should make sure to wash their hands frequently, cover your mouth if you're going to cough or sneeze, regardless if you have the virus or not. It is extremely unlikely that people ages 10 to 19 are going to contract the virus. The public is overreacting slightly, but the virus is serious enough and is spreading quickly. Safety precautions should be taken seriously. In order to learn more regarding travel and the effect of the disease, we sent our head scientific investigator to interview Nick Sapli, who is recently in Italy and is currently in self-quarantine.
Hi everyone, thanks for inviting me to be part of this press conference regarding the coronavirus. I'm Emily Sapli, the head scientific investigator of global virus and disease. I've been researching and investigating the virus since the first outbreak in Wuhan, China, back in December. But I'm here today with Nick Sapli, who just got sent back into the United States after studying abroad in Italy because of this virus. So Nick, if you'd like to come up, I'm just going to ask you a few questions. So how are you doing since you've returned?
I'm okay. I kind of wish I was still back in Italy though.
Oh, why?
Because my study abroad program got cut 2 months short, and I had a lot of things planned, and I really wanted to visit other places.
Yeah, I understand that, but with the whole coronavirus thing going on,
Do you not think it was a good idea to be sent back?
I mean, I think the American media kind of blew it out of proportion. The Italians really didn't think of it as that big of a deal, and it was happening in their country. So I felt kind of safe. Also, the area that I was studying abroad in had no cases, so.
That's understandable. So today I just wanted to test you for the coronavirus, just to reassure people that not everyone coming from countries outside of the U.S. are infected. That'd be okay with you?
I guess.
Okay, so I'm just gonna test you really fast.
Okay, so that was 97.9.
So clear on that side. Just test the other side.
Same exact thing, 97.9. So as you can see, not everyone coming back to the United States is obviously infected or contagious or anything, but obviously we are taking precaution as he is self-quarantining for the next 14 days. So just to see if symptoms would show in that time. So how is self-quarantining going so far?
It's alright. Kind of sucks.
Understandable. So any symptoms to watch for everyone watching are sore throat, a cough, fever, runny nose, just like your usual like cold. But obviously there's no need to overreact or like go crazy, but my advice is to just be aware and safe when traveling and wash your hands multiple times a day. If you do think that you're getting sick or are catching a cold, just try and like stay home. Don't go out or anything. But yeah, thanks Nick for your time.
You're so welcome.
Alright, back to you guys.
Overall, you can stay healthy by washing your hands frequently and avoid unnecessary travel. Thank you for your time and stay safe.